today's topic, which is home care support using technology. And we got Anthony Nunez coming on here. Anthony, great seeing you. And really excited to have you as part of the discussion. You've really been a pioneer in this space of using technology for elder care. Before you jump into your discussion, let's make sure our audience gets to know you a little bit better. Tell us a little bit about your background and what got you into leading INF Care.
Yeah, thanks, Steve. Always great. My background happens to be on the technology side originally, doing work for DARPA autonomous systems, as well as working for a large government contractor in some future combat systems. So I have a lot of experience around software development. Since 2011, though, I've been immersing myself in the home care space and exploring various ways to implement technology that would be able to address the problem of aging at home. For me, it's personal. I started this because of what happened with my family, and we had to go through it. And I wanted to leverage the experience and knowledge that I was able to obtain from working in the technology industry and apply it to an industry that I have a lot of passion for solving the problems.
Great. Now, I, for those of you who have never been to, a lot of people in our audience, all they know is that we do these digital events, but we actually used to do live events. And one of the best programs that I ever did when we did a live event was with Rudy the robot. And tell us a little bit about, because I think you were truly a pioneer in introducing robotics to elder care. And tell us a little bit about that journey and how that relates to what you're offering now.
Yeah, great question. So, our offering with Rudy, the autonomous robot, was designed to help keep seniors in their home, to help keep them physically active, as well as addressing some of the other pain points they had. It was a very long research process, I would say between 2011, 2012 timeframe. From when we started out of the gate, we had an autonomous platform that we were just continually iterating and testing in the field. So, we've been all over the place in terms of the Northern Virginia, DC metro area, testing it, deploying it with people. It's something that we have really mastered to understand how to get older adults to interact with technology. And some of the things I'm going to talk about today are, how we applied a lot of those lessons from what we learned working with a mobile autonomous robot in older adults to applying it now to our tablet technology.
Great. All right. Well, I don't want to slow this down, and I want to just remind our audience to ask any questions at any point they pop in throughout Anthony's presentation. And then we'll, Anthony, if something's relevant as you're talking, I may sort of break in. Otherwise, we'll just, address any and all questions at the very end. But I'm going to duck behind the curtain here and let you take it away.
Great. Thanks, Steve. Really appreciate the opportunity. So I'm the CEO and co-founder of INF Care. What we do is we provide home virtual care focused on helping connect older adults to home care agency caregivers so they can be serviced in their home. And so, as Steve was alluding to, this is not exactly where we had started. We had started initially through 2017 to 2019 was really kind of when we were picking up a lot of steam. Before COVID, we had deployed Rudy, an autonomous robot that actually had a tablet mounted on its chest. And we had been everywhere. I mean, we were deploying Rudy anywhere that an older adult would have touched down, anywhere from assisted living homes to independent living homes to home care agencies, community centers. I mean, we were all over the place between 2017 and 2019. And we learned a lot. We were constantly iterating. We were paying very close attention to our customers, which for us are two parts. They are the people who provide the care, but they also are the older adults. And so as we were getting feedback, we were just iterating. My team and I, we were putting in a lot of work to make sure that our autonomous platform was really fitting the need of the older adults, but also the need of the care teams. And so, it was picking up a lot of steam. We were doing really good. We had, signed orders for the mobile platform going into the end of 2019. And then, of course, 2020 hit and everything kind of flipped. There were a lot of kind of challenges, a lot of roadblocks that were brought up as a result of COVID. And what we did at INF is we quickly adapted. We took our learnings and our technology, and we were able to actually port it from a mobile platform to a more regularly available technology like a tablet. And so with that tablet, what we were able to do was maintain the key portions of our solution. And that home virtual care platform that we were now implementing on a tablet would still provide that remote connectivity to a certified care team via a cloud interface. And it would focus on really the key aspects of what we viewed as the most important things for older adults and care agencies. And that was making sure we were able to increase the amount of connectivity to care. We are making sure that we're also supporting a healthy lifestyle. Now, this entails a lot of different things, but I think one of the key things here is we're encouraging older adults to be able to maintain a healthy lifestyle. And we're also focusing on making sure they take their medications on time. Now, a lot of those components are really interweaved together. So it's hard to kind of just say that we do just, one of them. And then, of course, we also provide mental engagement. This is important because it allows the care teams to really monitor the cognitive status of the older adult. And then for the older adult, we have engagements that are to keep their mind active, engaged. We're a strong believer that the body follows the mind, and that keeping your mind sharp and active was very important, especially during, the pandemic, which has been going on, making sure that we address depression, social isolation, which of course was there prior to COVID. But I think one thing COVID did is many of us who work in the home care agency arena and work with older adults recognize that COVID really just brought to the forefront the needs of older adults a lot more. They were there prior. Home care agencies, I'm sure, can ascertain that the workforce challenges were there prior to COVID. The other difficulties they were having were there. And what COVID did was really kind of just highlight those to people who were outside of the care space. Now, before I move on, I want to kind of talk about how this actually works in terms of from a conceptual standpoint. And so what we do is we collaborate with care teams, and I'm going to talk about those 3 different versions right now that we're working on. That care team does what they do best. They provide the care. At INF Care, we provide the technology and the portal to make that care deliverable. And so what we do is we actually port our software to a tablet, and we send that tablet to the older adult directly. Now, the tablet is simplified. The UI, the UX, that user interface, user experience is tailored specifically to older adults who are not familiar with technology. So we recognize that that's been a barrier for a long time for a large group of older adults. And what we wanted to do was really address that segment of the older adult population such that we could give them a technology not only that they could use on their own, but something that they could build confidence on. And then, of course, security and privacy were huge components. So we do not record audio or video at any point of the older adults and the care teams. And we make sure that the portal between the care teams and the older adults is secure. And the connectivity to care is actually a very important topic, because what we were seeing in the beginning of the pandemic was older adults were pulling back from home care. They were turning down home care because they were viewing it as a risk to have exposure by interacting with another human. And so they were pulling back from care, and that was very problematic. And so kind of in the midst of the beginnings of the pandemic, we were able to launch this and really make a difference in a key area of need for older adults. And that was really increasing that connectivity to care through a secure video call interface. A lot simpler than Zoom. We recognized that a lot of older adults were trying to get on Zoom. Families, care teams were trying to get older adults on Zoom. and it was very problematic to kind of get them to navigate to that point. What we were able to do was simplify it, and then of course back it up with data. Secure video call with an older adult is great, but it's nothing without something behind it to support those decisions. And that's really data that we're getting from all this interaction, from this monitoring of their interaction with our platform. We're able to provide only the care teams information on clients that they hadn't seen before. And so the whole idea here is really keeping older adults independent. And that's much more than just reminders. Reminders are very important, but reminders by themselves cannot be successful. And we've seen this over the course of our deployments since 2012 in learning the fact that it really requires a better understanding of older adults. So understanding what's going on with that older adult, how do they feel? And that's really done through the interaction our system has with older adults. Our software actually has conversations with the older adults that are designed to understand their patterns, build trust between them, and then of course help guide them into a healthy lifestyle. And obtaining that information for care teams is important because you want to know, where did this originate? Why has their mood been dropping, and how does that correlate to other things that are going on in their daily patterns? And then of course increasing that ability to be able to reach out to care when they need it, rather than making them wait for the next scheduled visit. And so home care teams at facilities were able to now understand their clients a lot better and see changes in patterns before they became a problem. And that was really a key important thing for us at INF Care, is we wanted to really make things easier for care teams to understand the older adult and understand changes in their behavior before they become a problem, before they become an ER visit, before they become something that causes them to lose their independence. And then of course, being able to set target goals, offload repetitive tasks or other tasks to our system, such that caregivers would be able to focus on where they can offer the most value. Now, right now we're working in a couple different fields. One of the things we're doing right now is, in the beginning of the pandemic, we actually launched our product with Medicaid. It was a year-long case study, and it was turning out to show some really phenomenal results, particularly in the medication adherence. Now, Medicaid, as many of you know, is different from Medicare in terms of the population you're serving. Most technologies go to Medicare versus going straight to Medicaid because of a lot of those challenges. But at INF Care, all the work we had done with our robot and prior and our software, we recognized that we had a unique opportunity to really heavily vet and validate the utilization of our technology with a population that often gets left behind. And with this particular population, we're looking at high-risk older adults with multiple chronic conditions. These are people that are typically regular ER visits. And what we saw was phenomenal. We saw a medication adherence go from 50% to 99%. That's not an easy task to do, and that's something that we're really excited about. We also saw the increased touch between care and older adults by 3x. So they were able to interact with an older adult 3 times more than they were before. That's really important, because that, combined with a lot of the other things our software was doing, was really able to drive a key metric that we really hadn't been tracking at that point, and that was reducing the amount of time an older adult would go to the ER. Now, many of us know that in the midst of COVID, you wanted to keep older adults out of the ER. Going to the ER, particularly in the beginning, mid stages of COVID, was very problematic. And even now it is as well. But we wanted to make sure that we focused on driving meaningful results for that particular population. So that's wrapping up in June. We're going to be releasing a report on that case study, which is going to be really exciting, highlighting some of the things I've said and more. What we recently did, in fact, last week, we just launched an effort with an independent living facility, Culpepper Garden in Arlington, Virginia. That actually came out of a contest that Culpepper had put out back before COVID in 2019, where they were looking at a lot of different technologies for older adults. And we actually won the contest to be able to deploy with Culpepper Garden. Of course, once COVID hit, it kind of threw things into a little bit of a delay. But now that we were able to work some things out, now that the vaccines are more available, we were able to start deploying with that. And that's really exciting because one of the things that we're doing with Culpepper is really enhancing their ability of the older adult residents to interact with more people. So isolation, depression was a huge factor for older adults in independent living facilities. I'm sure many of us know, those who work with facilities are very much aware of it, but they were having to isolate from family, from friends, and even amongst other residents at times. And so what our goal here is to really kind of turn the tide on that isolation and really increase that connectivity amongst their community. And so that's really exciting. In fact, when we just launched last week, we already have seen a high utilization on that portion of the technology. Really exciting. 2 months from now, we're going to be releasing some of the findings on that. We wanted to also increase engagement. And now this is engagement between the staff, the facility staff, and the older adult, and also focus on keeping the older adult on task and helping the staff understand what's going on with their residents and to be able to better service their needs. So it's really exciting. It's something that's ongoing and really just starting right now, but that's our other effort. What we are launching in the next week, 2 weeks, is going to be a private pay home care service here in the Northern Virginia area. We have a home care agency partner. We'll be announcing that in about a week that will be providing that care. It's going to be the Home Virtual Care Program here in the Northern Virginia area. And again, it's focused on the needs of home care agencies. And so home care agencies have a lot of challenges. They're doing a lot with the little, and they're stretched in. The last thing they need to do is buy technology or try to manage the technology to be able to service their clients. And that's why for home care agencies, we're really their partner, their technology partner that they can rely on to do all the heavy lifting on the technology side. So all they have to do is really continue to do what they do best, providing the care. And they can do that at a lower cost and a higher margin. Very important for early to mid-stage home care, because that is where a lot of the home care agency costs go to. And of course, growing the customer pipeline versus trying to constantly hire. Now we can help home care agencies focus on driving customers into their portfolio, and they get to understand those customers better and retain them as customers. And so as they continue down their aging cycle, this customer now grows into their portfolio, and as they need more additional services, there's no need to go anywhere. So it's a great solution for the business side of the home care agency, but it's also an excellent solution for the clients, the older adults that go to home care agencies, to be able to maintain that independence at home. Now we can actually drive that independence and keep them in their home longer. If I had to sum up what INF Care is in a few words, it would be about keeping older adults proactive and care agencies proactive on their needs. We recognize that older adults often go to the ER, they have a hospital visit, they have a fall, they miss a medication, and that typically triggers families to go looking for home care. What we want to do is really make home care proactive in the sense that we're able to provide them data on clients, the ability to reach those clients more often, and then of course reduce costs so they're able to provide a high quality of service, and most importantly, drive outcomes for those older adults, meaningful outcomes. I need someone to make sure my mom takes her medication on time. I need someone to make sure my mom does not get depressed. I need someone to make sure that my mom stays active and eats and drinks water and hydrates. All of these things are needs from families looking for home care and much more. And that's really where we focus addressing those needs. So that's INF Care in our platform. As I mentioned, it is 2 portions. It's the tablet that goes in the home of the older adult, and it also is the secure cloud portal for care agencies, independent living facility staff, and even families to be able to interact and understand older adults better. I want to open up the floor for questions because I know this is a new concept that we're introducing now, but it is really based off of a lot of research that we've been doing over the years. And so we're really excited to get to this point, and we're really excited to be able to service the needs of older adults at a time when we feel that is most important for them to stay at home. Thank you.
Great. Great. Thanks, Anthony. And really good overview there. And of course, I knew this was going to be your first question from Maher, is asking what is the cost of acquiring this technology? So how does that work?
Yeah, so it differs for independent living facilities and for home care agencies. For independent living facilities, it's really based on the amount of residents that are going to obtain the solution. For home care agencies right now, they're able to, as the older adult, they're able to get care for at $400 on the lowest plan for a month. And with that $400 a month plan, they're able to get a caregiver 3 times a week for each of the 4 weeks in the month. And then it scales up from there. We're able to increase the amount of interactions at the next level, which is 560, and then at the top tier level is 880, and that is the cost to the older adult.
Okay, and then obviously, like if a home care agency or a community purchased this, then it would be at a reduced fare because of the volume. Now, let's dive into that. I think something that's pretty cool is that tell us a little bit more about this Culpepper Garden pilot that you're doing, or for lack of a better term, but you were actually in a competition, a technology competition that Culpepper Garden, and for those of you who are either out of the area or don't know, aren't familiar with Culpepper Garden, this is a independent and assisted low and moderate income building in Arlington, Virginia. And I guess they had a contest or something to look at different technology that could be implemented to their residents, and you ended up winning that competition, correct?
Yeah, that's correct. There were a lot of great technologies that really kind of span the whole spectrum of offerings. I mean, anything you can think of that's been offered for older adults over the last 1.5 to 2 years was, what we were up against, and we were able to secure, the win, which allowed us to be able to deploy that technology with Culpepper now. And one thing I might add, just on your last point, is home care agencies don't purchase the tablet. It's actually leased, so there's no need for them to house or store or own the technology. And so when the service is done, it's returned back to us. And as I mentioned, the idea there is to keep everything really smooth for both IL facilities or home care agencies, where they're not having to take on an additional item on their list or have to worry about technology upgrading, servicing, or anything like that. All that is handled by us.
Okay, so they're leased, and they could either pass that along as part of their services that they're providing, or they could add it as an extra expense for the clients. And you had talked about a nurse, like you had talked about a caregiver visiting. Go over that again, because I'm thinking that you're providing technology, but do you actually have caregivers that are visiting with the clients outside of the caregivers that an independent or a community or a home care would provide?
Yeah, so at INF Care, we just provided technology. And a moment ago, I mentioned about how older adults can get home care for as low as $400 a month, and what that entailed in terms of multiple visits a week through our system. Those visits, those check-ins are done by home care agency caregivers. And so that $400 is really kind of the entry point for older adults to get care. And we have a complete cost breakdown analysis that we share with home care agencies. So, this is something that we've thought out. We've understood the home care agency, financial challenges that they have. We understand where their costs go. And so it makes a lot of sense for home care agencies once you see some of the details. But basically what, to answer your question, Steve, is the caregiver logs in on our secure cloud portal from their home or from the home care agency office, and they're able to see the list of clients that they're responsible for, and they're able to do their check-ins and understand those clients before doing the check-ins. So they're typically looking at the report section. Once they look at the reports, they're understanding what's going on with the client, what's changed, and then they're jumping into a video call. And the reason that's important is because if you've ever done a video call with an older adult, you could probably spend the good part of a half an hour just trying to understand or get them to tell you what's going on, what's bothering them. And then after that 30 minutes or so is up, you haven't really addressed the issue. What we do at INF Care is provide you that data on the clients so that you understand where the issue lies, so that when you jump in on a call, you can make it much more impactful by jumping straight to addressing the issue and helping turn that around. So one example I had up on the slides was mood. Seeing how that mood is possibly tied to something, as I showed in the deck, pain, and understanding what is going on there with the older adult and how we can turn that around. So that's an important factor there.
Excellent. Okay, so the let's see, just double checking here. I want, if anybody in the audience, just a reminder, if anybody has any questions or comments that you'd like to share with Anthony, you can type those in using the Q&A box at the bottom of your screen, or you could raise your virtual hand and we'll bring you on live. And the so now the Culpepper Gardens program or project, how many residents are involved in that? And so this is a building where are each of the residents in the entire community getting a tablet, or is it just a select few?
Yeah, so for the competition, the idea was to pilot initially for 1 to 2 months. We chose the longer 2 months, and it was going to be a pilot with a small group of residents that were open to participating in what Culpepper was organizing. And so we're deployed right now with only 6 residents over the next 60 days. And then we're going to see what the next steps are from there in terms of working with other residents. I know that we had a stronger interest than we had initially planned, but we wanted to stick and stay true to the pilot metrics that they wanted to start with.
Great. And then you had mentioned that next week you're going to be announcing a partnership with a home care provider, but this technology would not be exclusive to just one provider. Many communities and many home care agencies could be utilizing this, correct?
Yeah, if there are other home care agencies that are interested, reach out to us. Absolutely. You know, we're looking at different regions here in the DC metro area. Right now, we're focused on just Northern Virginia, but absolutely, if you have a home care agency or an independent living facility, definitely reach out to us.
Okay. And then Meher had a question. Are you still doing Rudy the robot? And what's the cost of Rudy the robot? How does that work?
Yeah, so the idea, Rudy is still very much in play right now. You know, Rudy's kind of on the back burner because of some of the challenges of the pandemic. I mean, one of those was how manufacturing plants just completely shut down, you know, back in February of 2020. We were getting it produced. We were aiming to produce it locally here on the East Coast of the US. And so that was, you know, one of the barriers. There were several others. So we're very much, you know, keeping our eye on the market. We're going to continue to work with the tablet technology for the time being. As the tablet technology continues to roll out through, you know, our efforts, we're going to go back and revisit and bring Rudy back up. The cost of Rudy, it will probably be something similar in terms of cost structure to how we're doing the tablet. We're going to have to go back and revisit that because it's going to be about 1.5 years since the last time we we had that cost structure, and a lot of things have changed, so we want to update that.
But the model, whether it be an individual in their home or like it's a leasing model. So if somebody has Rudy in their home, more than likely it's a leased model through a home care provider so that you're getting that interaction as well, correct?
Yeah, of course. What we're doing is we're not replacing the humans in the loop. Rather, what we're doing is providing a tool so those humans can do their job better and be more efficient and effective. And Rudy would be another example of that. It would be under a leased model because, again, that puts less burden on our partners, our care partners, and that's something that we're going to revisit probably not too far, as we get later into 2021.
Great. And then somebody asked, how much of an issue is it teaching the client to use the technology?
That's a great question. With Culpepper, the whole group, I mean, it was really mainly just a conversation. It took a few minutes, but what we did with Medicaid was just put a very simple set of instructions along with the tablet. We've stripped a lot of things off of the tablet that makes it very difficult for older adults. We've seen this over the years. We've added our technology, which is very simple. So it's about 3 buttons for the older adult to hit. Again, it's targeting older adults who have not utilized or are familiar with technology. So those are the older adults that are the most comfortable in terms of using it. So it's very simple. What we've seen is, as about 10 minutes, they're firing it up on their own in their home. They're reading the instructions. It's a single page of instructions that goes over how to get it set up. Once it's set up, it's online and it stays online, and there's no other challenges from there.
Great. Okay, let's see, guys. Let's see. Do we have, so it says, Zelma says, thank you so much for technology and thank you, Steve, for continuing. So can a family or an individual get this technology or must it be obtained through a group agency or a group organization?
Yeah, that's a great question. So today it has to come along with the home care agency or as part of the independent living facility. So we have not opened it up for strictly family caregivers as of yet. There is a family portal. So if you are a family who wants to engage with a loved one who might be at a distance, you're getting a home care agency, then you're relying on that home care agency to understand what's going on. Our solution would be perfect in that case for you as well, because the home care agency is able to do those check-ins. You're able to get reports from our system as to what's going on with your loved one, and you're also able to jump in and conduct video calls. So that family portal, we're going to see how we continue to build that out, but that's not the first time we've been asked that.
Okay. And then Jason Brown says, what training is provided for the virtual care providers? I mean, this is a different way to do business. And also, like, I just, well, answer that question. And I got a follow-up question for you. So what training is provided to the providers?
Yeah, we provide the training. We actually provide the training for the care providers. So whether that be the agency owner that wants to see oversight on their staff and our system, or whether that's the actual caregivers that are actually doing the daily check-ins, we provide that training. We also provide training materials such as videos and also manuals, so they're able to fully understand. And we stay in the loop. Again, we recognize that this is a new process for many agencies or facilities. And so that's why I mentioned, we really are their technology partner, where, we're making sure that you can be successful at utilizing the technology to its fullest degree. And that if you have any questions or any challenges, we're always either a phone call, a text, or email, whatever's convenient for you to get your question answered.
Okay, great. And then I had, a couple of questions. First, you had mentioned that you did a study with Medicare. So is there potential that this is going to be covered under Medicare?
Yeah, so that case study with Medicaid was
Medicaid. Okay.
Yeah, we're completing that in June. One of the things we are looking at is really on the reimbursement side. I think a lot of people have seen the articles on telehealth, of course, increasing its reimbursement as well. This is a little different. We are non-medical today. We are non-medical home care. I think that's important to emphasize, but we are moving to a more broader sense of being able to incorporate other data that may kind of pull us into the medical side. Either way, we are working towards being something that would be reimbursed probably in the near to long term. So I would say that's something that would not be available till end of 2021, probably early 2022 Q1.
Okay. And then what was the purpose of, if Medicaid is working with you here, is there sort of a purpose to this study that we can be on the lookout for? It's seems pretty exciting and a great, very cost-effective way to deliver care to low-income individuals.
Yeah, I think the three things that you're going to see highlighted in a report, of course, are costs. That's one of the major things, particularly again, with Medicaid clients. I think anybody who's serviced Medicaid clients understands that the government has a lot of restrictions in terms of what they pay. So trying to make it work for your business and service those clients effectively has been a huge challenge for home care agencies. This really alleviates that concern for home care agencies. So cost, outcomes was the other one. I think outcomes is probably, in my book, probably the most important, because it really helps and ties into costs, but helps the older adults stay in their home, which everyone knows that the longer we keep them in their home and the more we keep them out of the ER, the more money we save. The third component I think that you're going to also see in the report is really the engagement. Getting older adults to utilize this type of technology, this particular population of older adults, and what that looked like. What did it look like in terms of how did they feel about the technology, the use, the type of engagement, the form of engagement that was used to, get them to stay on task with certain things like medication. All of that will, really be highlighted.
Great. Well, it's exciting that they're doing research in that area, because we all talk to Medicaid recipients, and currently it seems like the only option they have is this skilled nursing center, and that presents a lot of budgetary and just caring challenges. So the other question that I wanted to ask is, you keep on referring to independent living communities. I'm wondering, are you seeing this in a community setting exclusively for the independent living, or do you see this as a product that assisted living could be utilized? Because I oftentimes look at the home care client and the assisted living client as somewhat one and the same.
Yeah, that's a great question, Steve. Right now, we are focused on the independent living side. We have explored in the past working with assisted living. In fact, we had deployed even Rudy in the assisted living side. So, there are applications for it. For our immediate focus, right now, it's really on the independent living facility side.
Great, great. Okay, well, I think we've got through the questions, but always when I throw this out, one or two more come in. But what I would sort of say to you, Anthony, is that in sort of closing, if you wanted to sort of add any elements or uh, thoughts that you wanted to share with the audience and the listeners.
Yeah, the one thought I would like to leave everyone with is the fact that we're putting more emphasis on the early to mid stages of care versus the later stages with the implementation of this technology. This technology helps care teams overcome a lot of the barriers to implementing a type of technology, which is the fact that it's very easy to use. It helps drive meaningful information to the care teams that they can act on, and helps improve decision making across the board. We are your technology partner. We help you through every step of the journey, from beginning all the way through implementation. And it's something that we're very passionate about. This is not something that we just entered into the field with here in 2020. It's something that we've been working on for a very long time and really perfected and mastered working with older adults and advanced technology. So, reach out to us. Take a look at our site. You can talk to Steve. He's known us for a long time, and we'd be happy to talk to you. If you have a situation, you have some challenges, let's talk. We can more than likely help you out.
And I knew it. Whenever I sort of say we're going to be wrapping things up, we get another question, and we've got somebody that says oral history coronavirus stories. Washington Post story about a 70-year-old mother who stayed home, never went out after COVID threat began. Her daughter worked in a nursing home, got COVID infection, lived at home. Elderly mother exposed to COVID. Daughter, sadly, the elderly mother passed away. The story is on the internet. Could the daughter have remotely cared for mother using your technology? Oh, that's okay. So long. Sorry, I had to kind of read it and think through it, but there's a recent Post story about somebody that stayed home. The daughter worked in a nursing home, exposed mom to COVID, and the concept would be, using your technology, does it can it eliminate the contact? I guess would be the way that I would read that question.
Yeah, absolutely. In that case, I think it's a very unfortunate situation. I did read that story. Our technology, that's exactly where we focus. We focus on making sure we help keep older adults safe. We help them be able to stay connected, and we help them also stay on task. So that staying connected absolutely entails the family. It also entails the care team. So in that situation, I think we could definitely make an impact, a positive impact for older adults and for the family in those cases. So, I think it's something for people to keep in mind. As obviously we're going into summer now. We looked at what happened last summer. Things improved, but as we got to the end of summer and into fall, things took a turn for the lesser side in terms of how things were progressing. So, please do reach out now. Let's help you stay ahead of things with clients, and help you really grab some of those clients that have financial concerns or safety concerns. Let us help you grab those clients and bring them into your portfolio so you can start caring for them.
Okay, great. Let me just double check our Q&A. Looks like we got through everything. Looks like chat is okay. So, all right, folks. Well, Anthony. Thanks for tuning in, for sharing this with you. Congrats on the Culpepper Gardens and the Medicaid projects. I think you've done a great job of sort of getting some of these pilots out there. I've been amazed at some of the things that you've done over your career, and really excited to have you back on and hear perhaps some of the people in the audience start implementing your technology, and we can kind of hear some of the success stories. So we will share the recording. We'll share Anthony's contact with everybody, and definitely stay in touch.
Yeah, absolutely. Thanks, Steve. I have my contact information up on the screen, INF.care. You can also find us on Facebook at INF Care for Seniors. So reach out to us, like us, follow us. We're going to be doing a lot of things over the next coming months. So look forward to staying up to date and in touch with you, Steve, and the group.
Okay, great. All right. See everybody, and feel free to tune in at 2 for the Ask the Audiologist. We're real excited about that. Okay.